this session, this panel, has really been focused on moving beyond simply an implementation of expanded access as a compassionate use, and really trying to truly integrate it into the overall development and clinical research plan for drug development in order to create better treatment protocols and better information for providers. Now, one of the focus that I'm going to take is to really discuss one element that I think is critical here. And if you look at over the course of my medical career, I've gone from where all record keeping was done by pen and paper all the way up to now computerized systems. And the ability to collect and aggregate the data is a critical component of being able to do this when you talk about integrating expanded access programs across multiple countries. It becomes a data aggregation and collection, aggregation, and integration issue that has to be addressed. And the reality is the healthcare sector in general has been quite pathetic at the utilization of information technology in general. When we have very good examples, I'm sure everyone sitting in the audience here probably has your boarding pass for your flight home on your phone. But how many people actually use their phone to have anything to do with their healthcare? We just don't do a very good job, and when we do try to implement it, we usually throw more and more of the requirements of data collection onto the healthcare providers themselves, which takes away from their ability to interact with their patients and actually to do their job. So one of the problems with the healthcare utilization of information technology is that if you've seen one EMR, you've seen one EMR. Every instance at a hospital is a unique situation, and so just thinking about aggregating data across medical institutions is not a simple, trivial task. So one of the focuses, one of our projects that we're doing at NCATS in collaboration with the FDA and the CDC is really trying to think about transforming the clinical data landscape. So if you look on the left here, we have current workarounds because different institutions use different data models, and trying to aggregate and integrate all of that is a real nightmare. And so what we're really focused on is trying to find a unified solution.